Luckily, we are working with many partners to have a more comprehensive approach to addressing youth mental health needs. We're grateful for the Title V Maternal Child Health Block Grant Funds that enable us to provide this education today. Before I introduce Dawn, I just want to remind everyone to mute their phones. Thank you if you share your camera, but we know it's over lunchtime also, so whatever you're more comfortable with. And so, Dawn, we are grateful that for all your consultative support in this project and for all the experience he has brought to our work in equipping us for better supporting our youth mental health needs. Join me in welcoming Dawn, Dr. Dawn Bilau. He serves as school psychologist and has extensive experience in working with children and adolescents. And we are so pleased he can share this content with you today. Thank you, Dawn.
Thank you, Chris, and thank you, Four Corners Health Department, for sponsoring this series of workshops, which are touching upon how can we improve the skills of our youth in our area who experience a variety of diverse differences, and certainly for those youth and children who experience autism, the adults who care for them in whatever capacity, whether it be within a parent role or within a instructor role or any type of role that might be, it's important for us to remember that these youth who experience such differences see the world somewhat differently than adults. Kids in general do anyway. But when you have these sort of unique characteristics, then certainly it challenges us as adults to be sensitive to their needs and how they perceive their world. So the next hour, we're going to be talking about a variety of different types of skills and needs that we should be cognizant of as adults and working with these groups. So once again, thank you for this opportunity to share this time with you. So we'll move very quickly through the content, and if there's any type of questions or comments, please feel free to put that information in the chat box, if you will. And here, if you see the reference letters or contact information for Four Corners, Chris and Sarah as well. So this is information that is presented for your recognition. Also, looking ahead, Four Corners is going to be providing a terrific workshop, a day workshop, if you will, building a healthier community addressing mental health stigma. And certainly within any community, whether it's a large community, medium, or small, or a rural setting of any type, mental health stigma is a significant force, often an unseen, invisible force that is like the elephant in the room. We know it's there, but sometimes it's hard for us to acknowledge that presence. So this particular workshop will be focusing upon developing information and knowledge that will help each community address that mental health stigma in whatever capacity that the participants come from. So we look forward to seeing you on Thursday, November 2nd in York, Nebraska. And perhaps Chris can chat about that a little bit more later on. Again, quick reminder, feel free to put questions in the chat box, any comments. You can see my email address here as well, Chris's as well. And later I will put my email in the chat box as well. So moving ahead, I'm not an artist, so I can't take any credit for this, even though the side slice is copyrighted. It is not mine. I borrowed it from somewhere many years ago. But I think it's a great illustration in terms of how many of our youth, particularly youth and children who experience autism, see the world differently. And when we look at this picture, some of us will see at least 2 or 3 different images. One of them, if you take a look to the right, you'll see pretty clearly it's a face. You can see the presentation of a mouth and nose and eye, if you will. Then you look a little bit closer and suddenly you see, oh, I see a tree with birds flying towards little birds in a nest. It's kind of the way our kids will experience autism. They see the world differently, they perceive it differently, they react to it differently, or they just simply miss items. They miss information. So, for this picture is a great representation in terms of simply how certainly individuals with autism may experience their world differently. So as we move forward, keep those thoughts in mind. And certainly today we're going to talk about the core symptoms of autism. We're going to hopefully talk about the types of at least two skill sets and strategies that youth experiencing autism could practice. And we can perhaps be able to give them opportunities to identify other skills, such as problem solving skills as well. And at the end of the day, we want you to be aware that certainly youth in general, and particularly these youth who experience autism or perhaps other what we call comorbid conditions, they may experience a higher risk for suicidality, or self-injurious behavior. So it's important to recognize that when you sense that a youth or a child is in particular distress, or if they are exhibiting signs of suicidality or mentioning phrases like "I wish I was dead" or "wish my life was over." Certainly, we need to take all those words, all those expressions seriously, and within the world of youth experiencing autism, those words have unique meaning. So we certainly need to be sensitive, particularly to those sort of changes that these youth might experience. So we're talking about autism. What is that? So we're going to take about 5 or 10 minutes and review what we know about autism within the world that we work with in terms of our children and youth. So the types are what we used to be called ASD, Asperger's syndrome, childhood disintegrative pervasive developmental disorder. All these have been kind of lumped under this idea of autism now. Now, what's interesting is that educationally, and every state's different in terms of verification guidelines for special education, the definition of autism may vary educationally from state to state. The medical and mental health verifications or diagnoses are grounded within the mental health terminology. So the terminology in these two worlds, education as well as mental health, medical world, may overlap and may be somewhat a little bit unique. So that's even more confusing for parents who may be told by an educational setting that, yeah, your child does or does not present autism, does or does not qualify for special education, whereas there could be a medical condition where the doctor or mental health clinician has signs off on that diagnosis. So from a parent perspective, an adult perspective, what we know is that it's a term that's used interchangeably, and we have to be very sensitive to how that term is applied to the individual child or youth. So again, what is it? Essentially, it's a difference in terms of how that person's brain develops. Communication tends to be a critical issue in terms of being able to communicate their thoughts as well as feelings to those around them. And if you notice the bottom bullet, there's a reference to relating to others. That's where misperceptions can often integrate into how our children and youth of autism may interact with the world around them. And so as an adult, we often find ourselves continually checking and rechecking, clarifying, rephrasing, and becoming flexible in terms of allowing that youth or child to process information. When I say process information, it takes for these children and youth at times extra time to think and process an idea. to process an instruction. So oftentimes resistance is misinterpreted by us adults, and that we see a child being resistant to our instruction because of their lack of responsiveness, whereas in reality, it's just simply taking more time to process. And if you're emotionally charged, it becomes more difficult to process instruction and information. So that's kind of how that flavor and influence of autism with that brain or children you influences behavior. So certainly some of these young people, they have difficulty learning at times. Sometimes for some of these youth and children, their behaviors are extremely unique, variable, if you will, strange. For some youth, when they're early identified, they'll have unique flapping of their hands, or they may have perturbation of some sort. So you'll find that they simply look different, significantly different. And it's a continuum. Sometimes it can be relatively severe, sometimes less severe. And we seem to find ourselves in society today working with a lot of different individuals who have that autism verification or diagnosis at some level. And we're finding ways to assist them, and they're finding ways to work around us, by the way. So I think that's an important component for us to keep in mind, that the question often becomes, is there more youth and kids with experiencing autism today than before? We don't know the answer to that. But what we do know is that we're learning from those children and youth who are growing into adulthood that they're able to express how that experience of autism, different settings such as school, has impacted them. And they are letting us know, they're teaching us better ways to interact with them. So what you see on the slide is the idea of expression. Feelings are somewhat difficult. Understanding feelings of others can be difficult for some. But the key is many of these youth and children find ways of working around with support and positive reinforcement. Again, what's it like for these youth to experience autism? They miss body language. Like you see in the picture frame of myself, a lot of moving my hands is how I communicate. For a youth who may be experiencing autism, who's attending this particular workshop today, they would be perhaps extremely distracted by my hands and by what's on my ears and my background. They might find it difficult to listen to my words because of their focus is often distracted on something else. Handling sensory information, loud noises, bright lights, and crowds may bother them. Routines, changes of routines can be difficult for these particularly our younger children or middle school children. If there's a change of a teacher, a change of a routine, that can be challenging. For example, in a district I work with, 4 days a week we have a routine, except for 1 day a week, a Wednesday, we have a totally different routine. And every week, that's a different routine on that Wednesday. And predictably, our children and youth, may have more behavioral challenges during that particular day because it's out of sorts. So what do we do to help work around that in this district I work with? We coach them. We coach them up. And that's a term I think us as adult caretakers need to keep in mind, is our role is to be a coach and being a coach is that you point out what's coming, you reinforce a strategy to move ahead, and you review how that experience went, and you reinforce the positives of that process. So from that perspective, when we think about autism within our children and youth, it's useful to think about how adults who grow through that experience of autism and continue their paths of lives, what do they think? What do they say? That bottom bullet says it really well. We don't need fixing, we don't need pills. What we need is essentially people to recognize that being different is a good thing. Here's another phrase that I picked out of an article somewhere. I'm autistic. I don't want a cure to act normal. I want to not be stigmatized. I want to be given opportunities for accommodation in daily life. Just give me a chance. We talked about stigma a while ago in terms of mental health stigma. Certainly, there's stigma associated with children and youth experiencing autism. Again, thinking about from an adult perspective, in general, if an autistic or disabled person has told you they're suffering, then don't assume they are. People like me don't want a cure because we're not suffering because of autism. We're suffering from anything in society not accommodating and being accepting of us. I think it was useful words to be thinking about. So some of the myths is to kind of glance at in the next 4 or 5 minutes is a childhood condition. Now, it's a neurological condition. It's how the brain is wired. And oftentimes it's recognized early on within that early childhood part of the child. Myth number 2, individuals with autism don't have or want relationships. Well, that's certainly not true. They have fewer relationships, but they are able to identify relationships. Oftentimes they can sustain and maintain over a period of time, years perhaps. I have one a young person I began working with probably 15 years ago, and as a probably in early late childhood, middle school, senior high, and even through college, he still has me on his cell phone, and we chat once in a while. He remembers that I'm a friendly, supportive face, and he'll give me a call, and we'll just chat for a few minutes about how his life is going. And it's a great pleasure to hear that the person reaching out. So that connection is often there, but often these children have they struggle to sustain and maintain and understand romantic relationships and friendships. Myth number 3, autism conditions seen in boys. Well, in reality, it is more commonly diagnosed, which seems to reflect genetic factors, but it's also agreed that women and girls often slip through the cracks because the characteristics are different within girls and women versus men. Approximately 4.5 boys are diagnosed for every girl diagnosed with autism. It's related to intelligence and cognitive skills? My goodness, no. It's related to behavioral and social connections, not intellect. I have worked with a number of young persons who have demonstrated IQs, if you will, over 115 to 130 who have been diagnosed with autism, and are able to function on many multiple levels successfully within the academic and world settings. It's about learning routine and becoming proficient with the skill set within those areas. The relationship between autism and ADHD. Well, the reality is there is a relationship. And that makes it challenging for adults because you see almost 2/3 of kids with ADHD have at least one comorbid condition, and autism is most commonly that's identified. So, in fact, only particularly half the autistic kids have ADHD. So we're certainly now starting to see where these children and youth filters, if you will, their ability to perceive and misperceive is influenced by that neurological wiring they experience, which includes the influence of ADHD and autism. No wonder many of our parents are exhausted caring for their children as they move through the developmental stages, because it takes a lot of energy and patience to parent these children. What's the differences? Well, the most notable differences are you can see here the symptoms of ADHD is inattention. It's primarily a disorder of emotional self-regulation, those type of skills. Autism's problems with social interaction, primarily repetition, and issues of communication. So as a result, if you have the influence of both, you can certainly see the challenge to manage social interactions, manage impulsivity. Oops. So when we look at the research in general, we talked about this already in terms of how these conditions do influence children's development. And other parts of the experiences that these children can experience can include things such as OCD, anxiety, depression, bipolar, and so forth. And we wonder what is some of the anxiety symptoms these kids can experience? Well, we kind of touched on it already, but in more detail, we see restlessness, hyperactivity, trouble getting to sleep, repetitive body movement or noises, depending on that, particularly your younger ages of your children, will engage in the self-stimming, if you will, which is oftentimes a reflection of the anxiety that you're having difficulty managing and filtering. Depression, these are the symptoms that depression can exhibit, poor sleep and appetite, irritability, sadness, increased compulsive behaviors. As you can see, certainly children with experience these tendencies can be very challenging to manage and to teach workaround skills, which we're going to talk about in a bit more detail. But I think it's important to recognize that despite our best intentions, many youth in middle school, particularly high school, will simply refuse interventions, refuse engagement with adults. And part of that misperceptions or lack of insight in terms to understanding what that adult's attempting to do. And they will also refuse to engage in therapy, to deal with emotional issues that we just talked about, the anxiety, because from a therapeutic point of view, traditional talk therapy doesn't necessarily assist that youth into work through problems and experiences. The best therapy is a therapy that integrates what we call a multimodal approach, where you actually talk about, you role play, you draw different kinds of experiences out on a piece of paper. You don't have to be a great artist. Stick people work just fine. Arrows and circles and bubbles work great. Simpler the better. And it turns out that in interacting with autistic kids, that those simple dynamics allows communication to have a better connection, a better way for us adults to connect. So certainly have a piece of paper available. Colors work great to make points or to illustrate a point, because that reduces that tendency to not engage. And part of this also is that inability to trust or express themselves, because they don't necessarily see themselves being respected or validated, which oftentimes leads to what we call confabulation, where children and youth will, if you will, tell stories. There's a gem of truth in it, just a little bit of truth, but they may add in a lot of details about an event or experience that's just not accurate. We call that confabulation. We find that is frequent within children who experience traumatic brain injury, autism, and as well as ADHD. In fact, children who experience extensive trauma often engage in confabulation as well. Adults tend to think, well, you're just lying and you're doing whatever you can to get out of it. That's not necessarily how that child or youth is processing that information. Their brains are trying to make connections between events and experiences, and sometimes they build bridges using what we call confabulation. How do we deal with that as adults? We simplify. And that's where we're working with children who are experiencing autism. That's where it's helpful to draw out bubbles, if you will. Draw bubbles and draw interconnecting lines and say, I heard you say this, but I don't know how that made this happen. Help me understand. Notice I said, help me understand, because you're giving you're empowering that child, whether they're 10 years old or they're 14 or 18, you're giving them power to connect with you. Help me understand. A very simple phrase that works wonders. Which leads us into crisis management skills. When we think about our children who are stuck oftentimes at various stages of development, they're stuck with challenges that are both seen and unseen. And I just shared with you some of those challenges that these children and youth can experience. So it's important for us to remember that sometimes the different parts of their experiences cause them to be stuck at different developmental stages. Which means from managing crises, we ask what we think is a crisis, that child dismisses it. Doesn't quite get why you think it's a crisis. So you brought a water pistol to school when you are in the 4th grade that you're playing with over the weekend. You stuck it in your backpack and you bring it to school to show your friends on the playground. A plastic water pistol. How do you think the school's going to react? Well, predictably, there's a policy and practice that many districts have in place that anything that looks like a pistol, it is an automatic suspension. And if it is a significant issue, it may elevate itself in terms of the school district's response. And the child who just simply wanted to share might have been told about this many times, because many districts early on tell their elementary kids, middle school kids, anything that you bring to school in your backpack that looks like it could be a threat or could be used in a dangerous way or a harmful way, that could be cause for discipline or suspension. Well, our child with autism may simply miss that, because particularly if you're experiencing ADHD as well, what we know about ADHD is that those are children and youth who are focused upon meaningful pleasure. I want to have fun right now, taking a little water pistol to school to show my friends that they're experiencing ADHD as well as autism. Their filters are skewed. They're not necessarily fitting. And they may brandish that plastic as if they're playing a game they saw somewhere. So you can kind of see what I'm saying then, hopefully, that these children may miss. So it causes us to perhaps respond in a way that it certainly continue to confuse that child. So in interacting with that child or youth, we need to work around and their particular experience so that they can hopefully learn from that and change their behavior. So some of those key challenges in crises is picking up on social skills. They miss them, and they have difficulty communicating their own feelings and their needs in a state of crisis. And thinking of options, they're very narrow. It's hard for them to think about those options and connecting their behavior and with consequences. And fine-tuning their behavior so they look like it's appropriate and skilled can be challenging. So these are some of those challenges that kids experience within a crisis setting, such situation. So what can we do as an adult? Well, be alert for the triggers, Warning signs for that specific individual child. Try to reduce stressors. Be calm. That's the one skill we can bring and we can teach is calmness, because we might be triggered ourselves by that behavior. Oftentimes, from an adult perspective, caretaker perspective, we might feel like we're losing control of that particular situation because us as adults like control. So we may become emotionally reactive, and that can influence the interaction with that autistic child. So being calm is one of those skills we can bring and we can model for that child, that youth. Be gentle and patient. Ask in detail the location of a discomfort. Perhaps if the child is coming to us and is experiencing some sort of behaviors that are out of character, just simply out of character for what we're used to. There's a change, but they're not telling us. They're not communicating what the event is. Tell me what's going on. What does that mean? An autistic kid might have trouble connecting with them. I'm going to share with you a couple of really interesting little stories that was developed by a group that worked with autism. And so I have two different stories I'm going to share with you. They're brief. That illustrates the point of it's important for us as adults to be sensitive to the changes that these kids exhibit. And I quote, all of a sudden, when Mark was 8 years old, he needed order. The change came overnight. If we opened a cabinet, he closed it. Loading, unloading the dishwasher was impossible. He could not tolerate that door being open. It was maddening to us as parents and so clearly compulsive for him. He became anxious and acted out if the order was not maintained. Thankfully, our doctors ran some tests and discovered that he had some high antibiotics to strip, and the compulsiveness was likely due to a sort of obsessive compulsive disorder. The biological factors were not easy to treat and took a long time to resolve, but how we responded to this behavior changed completely when we realized he wasn't doing this to drive us crazy, and that he was no more in control of what he was doing than what we were. It turns out the bacterial infection had caused the change of behavior. And once that bacterial infection was treated, the behavior was reduced and the boy returned to normal. Another example is Sam's teacher moved to another city. So he entered his second year of high school with a familiar but less skilled instructor. Notices a change there. Soon he was headed to the nurse's office each morning and spending first period on her bed. Clearly, the new teacher had anxiety, and the school staff believed this was reflected in Sam's behavior and increasing his anxiety as well. Or perhaps it was just task avoidance, as there was a lot of language demands in that first period, social skills class. Then one morning he actually gagged and he vomited, but once he got home, it was clear Sam was not sick. Soon after, other staff noticed he would turn his head to the side and his eyes would roll during the period immediately after lunch. We also started noticing a tendency to retreat to the couch right after dinner at home. That's when we consulted our doctor, and sure enough, he was diagnosed with reflux. And all these odd behaviors and trips or changes subsided once he was treated. Couple of great examples of being sensitive to the needs of the kids and the changes that kids may exhibit who are experiencing autism. And try to identify by asking the kids what part of their bodies hurt. If they're having trouble exhibiting what's changed, ask them what type, what area. So trying to calm that child, give them space, give them time, provide clear directions, focusing on returning that child to a calm state, praising attempts to self-regulate and teach strategies such as deep breathing. Take a couple of deep breaths to relax if you're stressful, and is what we can teach the children and youth that we work with. And we want to be able to process and teach different responses later and debrief with that person later, so that, as well as others who work with that person, increase awareness of the triggers and strategies for that child or youth, particularly if you're working in a social situation such as school. So I think it's important for us to remember, now, crisis management requires all those kind of things we just talked about, but also other packaged interventions that we're going to talk about a little bit here. They're relatively straightforward and simple to use and to teach. For example, we'll talk about in a second here, sodas. We'll be talking about sodas in a minute. But I think here's an important point here I want to mention before we move to talking about sodas, is that children and youth will experience a crisis, become locked in time and space. And they find it difficult to develop insight that causes a change of behavior. Because asking someone to process an experience that was painful is going to promote resistance. So we have to be very mindful of that as adults and use a strategy that'll reduce that anxiety as much as possible when we start processing that. The key is that with consistency and routine, that's our kids experience autism, can find ways to work around. And while we can't control what happens, we can talk and teach to our kids that we can control ourselves when we're presented with a crisis. I think our last paragraph we need to remember is that as we work with these children, we need to remember ourselves, to remember that when we become anxious or upset, that child who lacks language skills to express themselves, they internalize it. They internalize that pain, which we as adults need to help them process. And try to explain all sides to the youth that we work with so they can get a better grasp of that crisis experience. That's where that idea of drawing things out in a manner, and for some do what I call side-by-side drawing. Ask that child to draw them out themselves, what they saw happening or what they're feeling, by using just maybe something simple such as faces that with different facial expressions to express what they may be feeling, and then connecting that with that experience. I think what we talked about a little bit ago about taking some deep breaths, that's a form of mindfulness, helping our kids identify ways to calm themselves and demonstrating that with them, and doing some role playing with them when they're not anxious and upset, to take some deep breaths. In fact, if you're in whatever kind of setting you're working with children with autism, it's important that you practice calming skills that the child can practice when they're not upset and anxious, so they have a go-to strategy. When we talk about sodas, I've mentioned this a bit ago. Sodas is a time-honored problem-solving approach that presents itself as helping that youth describe the situation, helping that youth identify at least one or two options in terms of responses, try to identify at least one or two disadvantages, and try to identify what would have been the best way, one or two ways of responding to that situation other than how they did respond, and then coming up with that solution. So it turns out that providing structure to children and with experiencing autism, I have found through the years, particularly using this problem-solving strategy, pays dividends. Now, I will say to you, it takes practice. But with times it becomes integrated into how they think themselves when they present are presented with a crisis, are presented with something they identify is unnerving to them. You can sit down with them and write their experience out in a format like this. Or you can go into more detail with something I call behavioral self-assessment. And these forms we can provide to you upon request. So that our kids have a medium to communicate. So part of our process when we start working with our youth is thinking about life skills and social skills. What can we do to promote that? So here are the key essential life skills that those of us who work with autistic children, youth, and adults to some extent will say to you are critical. Executive functioning skills, task initiation, daily living, personal care, occupational skills, safety, social skills, and self-advocacy. So when we're working with children and youth, a lot of these skills are just naturally addressed within the community home environment. But within different settings, there are some skills we can personally work with in terms of reinforcing. For example, self-advocacy. Modeling, role-playing with that child how to express themselves in a situation where they're not uncomfortable or when they're needing help. How do I go about doing that? So with practice, that child can learn to retrieve that information and apply it in different social settings. In my work with children and youth through the years who have experienced autism, who have exhibited behavioral issues, that's I have done. I've taught them sodas. I've taught them ways to self-advocate themselves. We practice that, and then over a period of time, if they have exhibited that those skills, I do whatever I can to reinforce that. I reinforce parents to teach and review self-advocacy skills, for example, safety awareness skills as well. And so that child on a continuous basis is then being able to recall what works. Remember what I said about working around. Our children who experience autism learn how to work around their situation, their experience, just as well we as adults learn how to work around their conditions so they can move forward in life. So working out what other people are thinking and feeling is a critical social skill. Understanding facial expressions and body language that others present to that youth. Adjusting to different and new social situations, solving problems, like what to do when you disagree with someone. Understanding unwritten social rules. Oops, there we go. Get caught up with you. Understanding new social rules. Solving those problems that we talked about. And sharing interests with other teenagers. You know, that last social skill is a very challenging skill for many of our children and youth. And it requires practice and reinforcement. Again, us as adults, in a very small way, takes 2 to 3 minutes, can practice a number of these skills with our kids that we work with and be able to see them integrate that themselves. We've talked about role-playing, self-management techniques, social groups, and talking with social media. It's, you know, as our teenagers who experience autism and ADHD move into the world of social media, it's important that we model and we monitor as well their access to social media to give them feedback about positive use. I want to go back to self-management techniques just a little bit. And you might wonder, what on earth does that look like? How can I do that? It can be something as simple as practicing delaying, what I call delaying self-gratification, training that brain to pause before you satisfy that need or that desire. It can be as simple as this: laying a piece of candy out on the counter and saying, "Here, I'd like you can have this, but I want you to wait 15 seconds before you pick that up. I want you to wait for 15 seconds." It could be a lemon drop. It could be something simple like this. Here's what the brain is doing. It's learning how to wait. Now, in our world of electronics and easy access, our autistic kids, our ADHD kids, well, they're struggling to learn how to delay self-gratification, because all you got to do is do this and you get an immediate response. It's a simple little technique I just described to you. You can increase it to 10 seconds, 15 seconds. You can make kind of a game out of that, so that that child, even that middle school kid, can learn to delay self-gratification. Social skills training. Social stories are wonderful. These kids love stories. They love YouTube, by the way. So selecting opportunities where you can process from YouTube or a TV program or something similar gives them an opportunity to listen, see, and process with a trusted adult a particular experience that they may be seeing. So certainly using it. I've also have worked periodically with kids who we've done a little videos, and snapped a little shot of a video and do a little role play and give it back, show it back to them, where we practice helping them identify what they could have done differently. With the technology we have, it's a simple practice to do, and it gives that child the ability to look and see themselves, and it gives us an opportunity to reinforce the positive efforts that are given by that child. We can see them start integrating those changes. I want to talk for a bit about mindfulness, because I think it's a key skill. And where you got to remember, our autistic kids, often their minds are very active. And they also struggle, particularly those kids who experience both ADHD as well as autism, with what I call time blindness. Time blindness. They miss a lot of activities. They miss a lot of different events because of my time blindness. They're just not sensitive to the passage of time. That's where that self-gratification, delay in self-gratification becomes a challenge, along with that time blindness, if you will. Teaching self-reflection is a key strategy as well. I was simply asking, are you telling yourself the truth? Is your recall accurate? Are you showing confabulation? We talked about that before. What would your world look like if you were let go of this particular thought of how you're describing an event? What do you need to do to move on in a helpful, not harmful direction? Are you hurting or helping yourself or others? Teaching self-reflections is a key strategy that we can do by presenting those questions, giving some feedback, and we can also do a little role playing with our kids. Now, meditation at its simplest is simply paying attention to what's happening in the present moment. This is a challenge for autistic kids. We can teach that skill by simply encouraging them to be sensitive to what they're feeling, hearing, and anything else that's just noticeable at that moment. There's no special place of calm one has to reach, but it helps them calm themselves. And here's some simple practice exercises that one can do with our kids. Help them find a comfortable place to sit. Help them think about someone that they respect and care for. and who really loves them in return, and ask them to think about how you feel as you think about that person, and make a kind wish and send it their way. This is a skill that within autistic kids, ADHD kids, any kid that's experiencing differences, this is a great skill to learn and to practice. Next, bring it to mind someone else you care about, and then bring someone to mind that you've been frustrated with, and send them a wish. And then check in. How did this activity make you feel? With practice, one can use certain part of the process as we move forward. So as we kind of pull our thoughts together, as we look at some of these experiences with our autistic kids and some of our skills that we can work with, I think it's important that we recognize that as parents and caretakers and adults, that we take the time. We take the time to understand and ask questions with that child, that youth, about how they're seeing that world, and letting them know that their brain's not wrong or broken. I can't tell you how many times in the many years I've been doing this work, and that our autistic kids share the thought that they're broken, because they get that feedback often from their peers and from some adults, because they are different in how they perceive and experience and how they exhibit their thoughts and feelings through various behaviors. So the feedback they get is they internalize, I'm broken. So our challenge as adults to offer support and care, and let them know that they're simply taking in information in the world in a different yet special way. So I think it's important for us to think about this idea that autistic children and youth often see the world as a movie where they can rewind and play back memories. And when they do that, sometimes it reinforces negativism. But if we can integrate the idea that you're cared for, you're valuable, that when they rewind their movie about us, it's going to be a positive movie. It's going to be something they can stay connected with as they move forward. Just like the youngster I shared with, who I'm still on his phone, his fast dial phone, where he will call me every once in a while and just chat. And we'll just chat because he's connected. And what we can do to connect is incredible. It's incredible what we can do as adults as we care for these individuals. They try to move through the path, their journey of life, which can be extremely frightening, extremely anxious for them. And it could lead them to a moment in time where they may feel somewhat out of touch, and they could lead into self-injurious behavior or suicidal ideation. It's important for us to listen to those changes and give them resources and opportunities to find help. Becoming a self-advocate for our kids is probably the #1 skill in my mind that we as adults can do, is to reinforce self-advocacy, to teach self-advocacy for them, and let them know that asking for help is acceptable, and it's a positive means of connecting with others. Oftentimes, these kids will have great difficulty asking for help. So we need to really focus upon that concept of becoming a self-advocate. Within the world of school psychology, within the MDT world, IEP world, if you will, throw all acronyms around, that's one of the goals I personally promote, is self-advocacy self-advocacy. And I work with teachers and counselors to encourage them to look for opportunities to reinforce that child or at youth being a self-advocate, because more than likely, once we reinforce it, it's going to reoccur. Once we notice it, it's going to reoccur. So when we think about these kids, I want you to be aware that there's a lot of great resources. In the last 10, 15 years, there has been remarkable growth of information regarding autism. And one website that has a great amount of information for adults, caretakers, educators is the autismspeaks.org. You probably hear about it on TV. I just heard about it just a couple of nights ago, where they were promoting their organization. And there's a guide that can be identified, that you can see on the slide, that really lists a variety of great resources and strategies in great detail that are easy to read and integrate for any of us. So as we kind of move forward, I'm going to see if there's anything that's in the chat box. Chris, is there any comments or questions that may have come up in the chat box?
Not yet, but as people think about it, please do. You can unmute and ask the question or put it into chat. But Don, I have a quick one. If you could connect the dots on why children with ADHD or those experiencing autism might be at higher risk for suicide.
I certainly can. So two reasons is that the child who's experiencing autism may misperceive the world around them. Okay, so they may misperceive the peers or adults in terms of their body language, the words they use, or they may in fact be easily influenced by someone who by a peer may say, well, just do it. Just kill yourself. Just end it. Just get out of my face and just go hurt yourself. And so that autistic child may hear those words, integrate those words, because they may misperceive those, or they simply lack the ability to filter those words out. Coupled with ADHD lends itself to high levels of impulsivity and emotional deregulation. So that child's misperceptions, impulsivity, and great difficulty in managing their emotions presents a higher risk to engage in suicidal or self-interest behavior than what another child presented with maybe the same kind of stimulation may experience. So certainly, I think when we work with youth in the educational settings, I'm hopeful that our adults can be sensitive to being aware of those experiences and use some of those skills we talked about for de-escalation to be able to get the kids to a safe place and process a little bit more. Does that answer your question?
Yes, thank you. Any other questions that are coming through?
Well, once again, please make sure that you place in the chat box your names and email addresses for attendance purposes. And again, I will see if I can put my personal address in here too, so that you can see that.
Don does that, if I could just close real quick with the thanks for joining us today. The slides will be sent. A recording of this will be posted on our website. The next workshop is next Thursday, October 12th, Improving Skills for Youth Experiencing Depression and Anxiety, again with Dr. Don Bilau. Please go to our website to register. And then again, please make plans to attend our November 2nd workshop. Flyers for all these upcoming events will be sent out to you in a follow-up email. And we welcome each of you to join in with us as we are working to make it easier for our youth to thrive. So contact me or Sarah on ways to get involved. And we are grateful for all the work you do with children. Thank you very much. We're glad to have you with us today.
So before we sign off, there is one question I would like to try to answer.
Okay,
And that's from Melanie. Thank you, Melanie. You
awesome.
articulated a very unique situation. And essentially what you ask is, do you have any suggestions how to best support parents that think they might have an autistic child not diagnosed yet? Some might be scared to reach out and ask the child's doctor, or might be embarrassed or in denial. I think the great way to do that, Melanie, it's a great question, is that website I shared with you a bit ago in the slides. And let me see if I can put that in the chat for your ease. I will share that website so that the family themselves can explore that website and see, does it speak to me? Is there some information that speaks to me? Does it help me understand some of the characteristics my child is showing? And so then you start building a bridge. So as a family advocate, I think your job is to build bridges and offer resources and information that'll help them move to an action plan to seek help. And certainly, what we're finding is that we're finding that when we look at the continuum of autism, we certainly have what we call, and forgive me, but the old phrase is high functioning autism, or Asperger's, if you will, which now is collectively under that general umbrella autism. We oftentimes those children may not get a medical diagnosis at all. But educationally, they might get that educational verification perhaps as young as a preschool child, or a child within the early elementary years, or it may be middle school before the symptoms present themselves enough for the educational system can respond and provide support and help for that child to be successful within that setting. So I'm going to suggest to you provide information, that resource. Maybe I think there's some printable worksheets or handouts that you can print and provide to that family. So in any event, it's not surprising that any family might be anxious about, geez, I think my child has something that makes them different. Not sure what it is. The first step is let's give them some more information to help them move forward.
Mm-hmm.
I think we have another message there. Okay. Good. All right.
Very good. I haven't
Great.
seen
Wow.
any other questions come in.
Okay, great. All right. Well, thank you for spending your time. Thank you for all your great work, folks. And again, remember the Thursday, November 2nd all-day workshop. And next week, we'll be talking about working with our children who exhibit emotional issues in terms of improving their skills. So we'll talk about that in great detail. Thanks a lot, guys, for your time, and appreciate it. Have a great day.
Great. Well, thank you, Don. I think it went well.
Yeah, I liked that last question. That was a nice question.
Mm-hmm. Especially for our family advocates. Mm-hmm. That was excellent.
Alrighty, and who's
Okay.
hosting tonight?
Angel will be with you again tonight.
Okay, 6:30.
Yes, 6:30 session, and I'm it's 6:15 or 6. When do you want to log on?
6:15 is fine.
Okay, good. Well,
Okay.
thank you so much, Don.
All right, we'll see you. Bye-bye.
Bye-bye.